After years of political battle and a rollout defined by mistakes and delays, millions of Americans will begin receiving insurance coverage today under the president's health care law. Of course, no issue will go further to define President Obama's legacy. According to the administration, 2.1 million Americans have now signed up for the plans through federal and state insurance exchanges. But the drama that, of course, has plagued the health care rollout, it doesn't seem to be letting up. Just hours before she led the countdown for the Times Square ball drop, Supreme Court Justice Sonia Sotomayor temporarily blocked the administration from requiring religious groups, some of them, to provide contraception coverage under their health plans. Sotomayor has given the government until Friday morning to respond. Ellis, Henican, a columnist at Newsday, and Ben Jacobs, a reporter for the Daily Beast, joining us now. Happy New Year, guys. Thanks for getting up.
Good morning.
Both
How are you?
Pretty sharp.
Hey, Ben.
No worse for the wear. Ellis, I want to start with you. How big a deal is this, and is there a precedent to be set here?
It's a medium-small deal, I would say. I mean, listen, this aspect of it, whether contraception has to fall under the Affordable Care Act, is a real, hard-fought, genuine issue. But honestly, it's something that a relatively small percentage of people care about. I mean, the polls tell us, what, 85% of Catholics use contraception? You know, so right. It is a philosophical and ideological debate with the right, but it's not going to have a huge impact on the health care that Americans get. And
it's not really political. I mean, she's more of a left-leaning judge, correct?
Right,
I mean,
right. And she is Catholic, don't forget that, but yeah.
What is going to happen? I mean, is the government going to do anything? I mean, I don't understand how this is going to resolve itself.
Friday morning, keep your eye on Friday morning. There will be an argument in front of the court that will debate whether this injunction that is currently in place until Friday morning, whether it lasts, how long it lasts. The government will have a chance to say that it shouldn't exist in the first place. This is the most short, temporary, little minor fix on the way to a longer debate.
Well, we talk about fixes and the long debate, Ben. We've already seen so many changes to the health care law already. We're in 2014. I can't say as we look ahead. Do you expect a lot more changes as we go here, as coverage begins? And we, of course, now have to work in the doctors, the insurance companies. What's going to happen in 2014 for this law?
Well, I think 2014 will be a big test of it as people go to the doctors, as people go to the hospitals, and make sure they see if they're covered and see if their coverage works, that they're already a little bit worried that people will show up and go to their doctors and it won't be covered under their plans, or they won't understand their plans. But I think at this point, it's not about the fixes, it's about the actual everyday practice of, you know, whether 6 million people are getting health care through this law, the number who've signed up, and whether it's working for them.
Do you think it's going to get easier to defend this law as the year goes on, or are we going to continue to have this negative story to have to deal with for people who support the law?
I think it's either going to get a lot easier for people or a lot harder to people. I mean, at this point, this is when the law is actually rolling out, that it's past the website. It's about whether people are actually getting the health care that's promised them. If the law is working, if the Affordable Care Act is delivering on the promises that it's made that people will get health care, then it'll proceed smoothly. If there's continued problems, then you know, then that'll become a much bigger issue.
It's hard to imagine it's going to get that much harder, right? I mean, because up till now, I mean, up to now, it's been the perfect thing to beat up on, right? I mean, you can put out these scare stories. Everybody's nervous about their medical care, and yet there's no actual service that's being provided. Right now, at least, Brian, there'd be some people on the other side who could say, hey, I am going to my doctor. Yes, the bills are getting paid, and for a lot of people, hey, I'm paying less than I used to pay.
You know, it's interesting because when I talk about the 2014 midterms, at first I was just exhausted by the concept of talking about this for another year, but I think it's now very nuanced. The Republicans, they can't really argue to repeal it. It's here. Right. So how do they frame their debate? And then the Democrats, well, they've had to sort of, some have, Mary Landrieu and some others have distanced themselves a little bit from it, but what if it all of a sudden becomes a very positive story? How are they going to message and deal with it? A lot of Democrats think they should get on the offensive much, much more. I mean, it's a nuanced debate for 2014, even though we don't even know how the coverage is going to pan out.
It is, but the political strategies, I think, are kind of locked in, right? The Republican strategy is going to be find every little thing that's bad about it and blast it, right? Find that one person who's suffering and make them an American conservative hero. And the Dems will say, hey, yeah, but on balance, most people are doing better with this thing.
Right. I want to switch over to NSA for a second, and Ben, I'll start with you. The conversation about Snowden, put it aside for a second. I want to talk about these recommendations and what Obama's going to do. From the people you talk to in D.C., what's the sentiment? I get the sense to some degree that some feel that it'll be a status quo.
Well, it'll be very interesting that my colleague Danny Kleidman at the Daily Beast reported exclusively the other day that Obama's worked through the recommendations, that he thinks about 3/4 of them can be adopted relatively easily, and spending time trying to figure out what can be done in dealing with the bureaucratic fighting that will result, because there's already pushback from a number of agencies about them, especially the FBI. That at this point, this is becoming one of the defining issues of the Obama administration in a way that the president didn't expect. That healthcare was always something coming up, Iraq was always coming up, but NSA and spying, and sort of the awareness of the historic implications of this decision.
You know, the phone companies, they don't want to be involved. They don't want to hold on to this data, but they don't want to also be bullied around here, and the government's got a problem. I mean, how's this going to pan out?
That's right. I mean, there is a growing agreement, left and right, that we do need some kind of process in place here, something a little more than the FISA courts, right? Some actual procedure where the government could say, hey, this is something we need to do, give us an analysis of it, and frankly, give the privacy people a chance to make the case about why it's so bad. We really haven't had that up to now. I bet you a year from now we've got it.
You know, but it's funny because, you know, I think it was Michael Hayden, the former NSA and CIA director, said, you know, you criticize it when nothing happens, and the second something happens, you want to give them all the information possible. So
you mean the public is unfair?
Is that sarcasm? Ellis, is that sarcasm? Appreciate it, guys. Thanks for coming in, Ellis and Ben. Happy New Year, guys.
Happy New Year.
Good insight here on MSNBC. All right, 2014 off.